Hello everyone, this is Dr. Rashid. Today I'll be telling you how to explain slides in your med school like a pro. First of all, what you need to know is there are different types of slides. Your slide may be diagrammatic, clinical, or histological. Then there's radiological as well, which I'll be telling you in a separate video. But these are your basic types of slides. For a more advanced stage, there are different slides as well, such as ground sections and immunohistochemistry, etc. Now there are certain rules when you start to explain a slide. Your rule number 1 is what is it? And then what do you see? The third rule is what else do you see? Once you tell all these things and then the fourth rule comes, now explain the slide. Now suppose you are looking at the slide. Your answer should always begin with this is a dash, showing us the dash in which we can see dash. Now when I answer this is a diagrammatic representation showing us the oral epithelium in which we can see all four layers of the epithelium as well as the connective tissue part below it. Now once you have spoken this statement, now you wait for the interviewer to ask what else do you see in it. This is the time when you start to explain the slide, the things that are important within it, like what are the shape of the cells and what else do they make, etc. and etc. Okay, so this is another slide. Your answer will again be the same. This is a showing us the in which we can see, and then you answer as this is a diagrammatic representation showing us the development of tooth in which we can see all the stages when the tooth develops. This is a clinical picture showing us the extraoral view in which we can see the upper and lower teeth in occlusion as well as the healthy gingiva. This is a clinical picture showing us the extraoral view in which we can see the tongue and there is a lesion present on the lateral border of it. Now this is where the things get interesting. When you look at a lesion, you have to describe what this lesion looks like. And to explain this, there is a simple 5S rule in explaining any kind of particular lesion. Now these 5S are size, shape, shade, site, and the surrounding. Now this lesion appears to be 2 to 3 mm in size, circular in shape, and pale or yellow in shade. It is present on the lateral border of the tongue and the surrounding appears to be normal. Now this is a histological slide showing us the oral mucosa in which we can see all the four layers of epithelium and the connective tissue below it. Now to perfectly explain this, you need to go back to the diagrammatic representation as well as consider your theory books for the explanation of it. The diagrammatic representation shows that the oral epithelium is made up of four different types of layers. Each cell is of different shape and it is of different function. Once you know that from the diagrammatic representation and your theory, then this slide becomes very easy to explain. When you read the theory, it will also tell you that in this wave of epithelium and connective tissue, these both have separate names. The epithelial part that goes into the connective tissue and the connective tissue that goes into the epithelium, these both have separate names which I won't be telling, you need to study them. This is a histological representation showing us the development of tooth in which we can see the late bell stage. Another way you can learn histology very easily is by drawing the histology yourself. Like draw a bell, like I have drawn like this. Draw tall columnar cells on its base and cuboidal cells on its periphery. And there will be star-shaped cells between these two layers. Below this will be the dental papilla and in the surrounding will be the dental follicle. All this structure is known as the tooth germ, whereas the epithelial part of this tooth germ is called the enamel organ. So this is it. I think this was the most easiest way to explain any slide when you're in your med school. But you do have to study your theory as well. Good luck everyone. This is Dr. Ali Rashid. Thank you.